Lactation. This is the process of milk production and the secretion from the mammary glands to nourish the newborn, controlled by the hormonal and the neural mechanism. Prolactin. Milk production, secreted by the anterior pituitary, stimulated by the suckling and estrogen, inhibited by the dopamine, prolactin inhibiting hormone. Oxytocin. Milk ejection and the let-down reflex, secreted by the posterior pituitary, stimulated by suckling, infant crying, and emotional bonding. Causes the contraction of the myoepithelial cells in the mammary glands, milk ejection, estrogen and the progesterone. During the pregnancy, inhibit the lactation by blocking the prolactin levels. After the delivery, placental expulsion leads to the drop in the estrogen and progesterone, allowing the lactation to begin. Stages of lactation. Mammogenesis, breast development, growth of the mammary glands during the pregnancy. Lactogenesis, milk production, stage 1 mid-pregnancy. Colostrum formation starts. Stage 2, postpartum days 2 to 3. Full milk secretion begins as the progesterone drops. Galactobiosis, maintenance of lactation, continuous milk production dependent on suckling. Milk ejection, let-down reflex, oxytocin-mediated release of milk in response to suckling. Weaning, gradual cessation of milk production when the breastfeeding stops. Composition of the breast milk. Colostrum, first 2 to 4 days. Yellow, thick, rich in IgA, lactoferrin and the leukocytes. High protein, low fat and the lactose. Transitional milk, day 4 to 14, high fat and the lactose content. Mature milk after 2 weeks. 4 milk, first part of feeding, moderate rich in the lactose. In milk, later part of feeding, high in fat, essential for the infant growth. Benefits of breastfeeding for the infant: provides IgA passive immunity, reduces the risk of infection, respiratory, GI, otitis media, decreases the risk of SID, obesity, diabetes and allergy, promotes the brain development. For the mother, uterine involution via the oxytocin release, reduces the postpartum bleeding, lowers the risk of the breast and the ovarian cancer, delays the ovulation, lactational amenorrhea. Common problems in the lactation. Engorgement, painful swelling due to the milk accumulation, management with the frequent feeding, warm compresses. Mastitis, breast infection, pain, fever, redness, treated with the antibiotics, lacloxylin, and continued breastfeeding. Cracked nipples due to the poor latch, managed with the nipple care and the proper positioning. Low milk supply due to the poor feeding frequency, stress, treated with the increased nursing, hydration and the rest. Lactation is controlled by the prolactin, milk production and the oxytocin, milk ejection. Estrogen and the progesterone inhibit the lactation during the pregnancy. After delivery, the drop allows the milk production. Colostrum is the first milk rich in the IgA, protein and the immune factors. Mature milk consists of 4 milk, watery lactose rich and hen milk fat rich. Breastfeeding benefits the baby by providing the immunity and reducing the disease risk. Breastfeeding benefits a mother by promoting the uterine involution and reducing the cancer risk. Common breastfeeding issues include the engorgement, mastitis, cracked nipples, and low milk supply. Lactational amenorrhea is an edged contraceptive due to the prolactin inhibition of the ovulation.